Welcome back to MedTech's Biomed Regional Focus as we continue our discussion and exploration of life science innovation in the Rochester and Finger Lakes region. I'm pleased to be joined today by the co-founders of HealthCare Originals, Sharat Samjit Singh and Jared Dwarika, co-founders of HealthCare Originals. Uh, Jared, Sharon, it's nice to have you with us today. Thanks for joining us.
Thanks, Win. It's a pleasure to be here.
Yes, definitely.
So, Jared, Sharon, I'll let you decide how you want to handle it, but we generally start these discussions by identifying the problem. What is the problem that the two of you set out to solve?
We set out to solve for a bigger, better solution for people with chronic respiratory conditions. And we started this because I have asthma. I've had it from birth. Solutions did not work well for me. So we discovered technology at the University of Rochester that we knew would be game changing for people with chronic respiratory conditions. And we then set out to commercialize that, improve upon the basic research that was done. And that's what brought us here, what we call our Nightingale Virtual Respiratory Care Service, which helps people by surrounding them with our proprietary digital device, as well as AI and human touch, to really bring holistic measurement and control and help people. And so we can as we go forward. But that's basically the problem that we're solving for. People with chronic respiratory conditions need better solutions.
Can you give me a sense of the scope of the problem?
So we have in the US alone, we have 55 million people with a condition called chronic obstructive pulmonary disease. When you put those two together, that's 55 million people. And worldwide, there are more than 600 million people who have chronic asthma and COPD. So we're not counting all the other respiratory conditions that go on out there. So it's and as well a significant problem for us right here where we are.
So let's turn to Healthcare Originals. Tell me about your solution. What is Healthcare Originals doing that others in the marketplace haven't been able to do?
So that's a great happy to talk about what we're doing. And what we're doing is offering our what we call our Nightingale Virtual Respiratory Care Solution. So we have a proprietary device that we have developed based on the research done at the University of Rochester. And it's a wearable that is the world's first monitor. And the wearable is an elegant, discreet wearable that you wear under your clothing. And this is it. So it's flexible, it's soft. Users do not understand that they have it on after 5 minutes. And it's worn under your clothing and it monitors for all the significant symptoms of respiratory conditions, primary of which is cough. So this is the world's first cough monitor that works in real time in the real world as you go about your day. You could consider it as a pair of spectacles. You put it on, go about your day. It's bios, it's on you, monitor your symptoms. And what we with Nightingale, what we do is we take that advanced, hyper-personalized contextual data and surround you with education, personal respiratory therapists, life coaches, as well as a certain amount of AI over time to help everyone understand their baseline and how they're trending away from their baseline. But more than that, empowering our members to actually understand how to take control of their condition. So when you think about companies in the diabetes space like Livongo, they have already proven that people with chronic respiratory conditions need more than just medication. They need people and help and personalized service to understand what their data is and how they can move forward from where they are now. And that's what we're doing for respiratory. Advantage for respiratory. And what we're doing that is different from anybody else is that hyper personalized contextual data that we get from our wearable. And the results are outstanding. Just on Thursday, we had someone come up to us. They've been in the program for a year and they've quit smoking. They have actually reduced their medication. So this not only just helps people live better, they save money, they do things that they have always wanted to do, like quit smoking. And that's all about the service that we offer, where we're empowering what we call our members to really live better with a chronic respiratory condition.
So I'm curious to know more about this concept of patient empowerment because, quite candidly, we've spoken with a number of innovators, not others in the respiratory space, but there is clearly a thread out there in healthcare innovation around patient empowerment. I'm curious to know from you kind of what is it that unlocked that issue as a significant driver in healthcare.
Okay, so basically, it's like traditionally people have been going to their physician, their primary care provider, and sometimes they feel intimidated with their primary care provider. So they just don't get all of the information. So they walk away, they come home. Oh, I'm not really sure what this is about. And then we evolved a little further with people doing research. Eventually, we're at the point where people are like, you know, just like how I want to find out what a good restaurant is, and I'm gonna do research and get all the information. Same thing with healthcare. You want to do your own research. You've taken the control of your illness in your own hands. Yes, you're doing your treatment, but you just want to do so much more. And it's a general trend in the world. Everything you're doing, you have so much more information that it just makes a difference. Your outcome makes a difference. Yeah, it's the empowered patient, the same concept as everything else in life now.
And it makes sense as a progression when, because when you think about it, we spend 0.1% of our lives with a physician, and those of us with chronic conditions live with our condition. So we want to make sure that we understand what's going on every day, all the time, and be empowered or educated, able to manage it for the times that when you're not at the doctor's office.
Let's turn our focus a bit to the two of you. Both of you have kind of extensive histories in the startup and entrepreneurial space. Tell me, Sharon, we'll start with you. Tell me a bit about your own journey as an entrepreneur. What brings you to where we are today?
That's an interesting. I think my journey is not the typical journey. I worked in corporate a big corporate organization for the first 20 odd years of my career. The interesting thing about that is, but I ran companies and portfolios within that organization, and they always said like, this is your business and just move with it. So I think that planted a seed within me, and then took what I would call a mid-career break in 2012 to come to the University of Rochester to do their technical entrepreneurship and management program. It's called Team. And there we found and figured out that this is what we wanted to dedicate the rest of our lives to. And from there, we've just been growing and really it's been very helpful with the entrepreneurial ecosystem that we found here.
Jared, how about you?
Okay, so my background, it's Sharon, manufacturing, engineering, operations, sales, marketing. So after you've covered all of those things, you're like, what's next? Maybe it's putting all of that to use for your own self. So when the opportunity came along to do something like that, it's because of everything you've been doing. And that brought us to this entrepreneurial moment where we're bringing a product to really solve a need in the world.
And help me understand, what's your vision for Healthcare Originals? If we were to look ahead a year, 2 years, 5 years down the road, where would you like to see the company proceed?
Okay, first of all, serving millions of lives, making a big difference. People just going about saying, I can do something I could not have done before. It's like, you know, I can life goal for somebody with COPD, I can just go walking about the place or something like that. And then the bigger picture is, let's think about something commonplace in your house, a thermometer. So everybody has a thermometer at home. They want to know when they have a fever or something like that. So our vision is that home that's possible, we are able to have one of our services, whether it's our device, our Nightingale service, our online service, that you're accessing to take care of your respiratory condition.
And tell me too, as we focus on various innovation regions across upstate New York, you've both spoken eloquently about the connections that you made at the University of Rochester. Are there other connections, programs that have been helpful to you as you've been growing this business?
Sure. Going from east to west, let us start, say, Syracuse, STLC. We were able to get very early on a very nice project that explored our freedom to operate. So that's a pretty good example of your protecting your IP. Then jumping across to Buffalo, we were able to tap into some CAT programs at the University, the Center for Informatics. Again, our business is all about digital data. And then here locally in Rochester, there's so much. There's the MEP program administered by NextCore. There's the actual incubator at NextCore. We were in NextCore even before the name was NextCore. So we've been mentored by them, numerous programs, and just being in that ecosystem. And of course, there's some entrepreneurial programs run by the University of Rochester and the 10 organization. They've all been great in helping us shape this moment.
And could add there's the Greater Rochester Enterprise as well. They helped us with an economic gardening project where when we started the Nightingale program, they were able to help us with some market research. So we could talk for hours about all of the things that have happened to help us in this area, but it's been fantastic.
Sharon, let me pick up because I know you particularly have some professional experience outside of this region. Is there something particular about upstate New York, something unique that you found in this region that's been helpful?
I think it's this region is still some place where we make things. A lot of other regions are focused on data, AI, those kinds of things. We make physical components, and there's a strong manufacturing base really across the regions this series is highlighting, but certainly, and that really helped us when we were looking to set up our company here to understand that physically we could still make things here and our products are made in the USA. And the combination of electronic expertise as well as all of the other manufacturing elements that we needed. I think that was one of the key things to emphasize again. People make physical things here still, and that's key for us.
And before we conclude, I'll give you an opportunity for you to talk directly to our audience. Are there things that you're now looking for? Connections, capital. Help me know what's on the wish list for HealthCare Originals.
So that's a great question. Thank you for asking. On the wish list, we are a startup, so of course, capital connections to capital are always a great thing, even for existing rounds or future rounds. More connect with employers and health plans who really want to do something meaningful for their populations. We can share dozens of customer testimonials that we have about how we've helped people, but more than that, we help them economically, and there are definite savings involved. So if you're a large employer and you want to take care of the 14% of your workforce that may suffer from respiratory conditions, and their families may as well, you want to make sure that you're really tackling the presenteeism, absenteeism, and productivity issues that you have meaningfully. We can help with that. For help, really saving money on respiratory conditions with a scalable program, because that's key. There's a lot of money thrown at respiratory, a lot of it is not scalable. We can give you that ROI on a scalable basis to really impact your health plan costs. So those are the two things we're looking for: capital, who want to help the people that they serve.
Well, great. Let me throw it to our audience. If anyone's out there and is interested in learning more about Healthcare Originals, has some connections, wants to reach out to Jared and Sharon and the team at Healthcare Originals, you can find them at healthcareoriginals.com. That's healthcareoriginals as one word.com. Sharon, Jared, thank you for spending some time with us. This has been a terrific conversation. Thanks so much.
Thanks, Win. It was a pleasure to be here, Opportunity.
Definitely.